Hey future RNs, want the inside scoop on what's definitely showing up on your NCLEX? This is your rapid-fire rundown of must-know facts and questions. Stick with me to lock in the essentials that'll carry you through. Let's go. First, ABCDEs in priority questions, ABCs, airway, breathing, circulation. Always use this for priority questions. Add disability for neurochecks and exposure for injuries or rashes. Second, antidotes and reversals. Know your antidotes. Protamine sulfate for heparin, calcium gluconate for high potassium, digoxin immune fab for digoxin, and vitamin K for warfarin. Third, wound care and infection signs. A red, warm incision could mean infection. Look for drainage or fever. Report it immediately to prevent complications. Fourth, crackles in the lungs. Crackles in the lungs mean fluid overload. Give diuretics like furosemide, not more fluids. Fifth, hypokalemia signs. Fact 5. Hypokalemia or low potassium causes muscle cramps, weak pulse, and flat T waves. Skip fever on select all that apply. Sixth, insulin peaks and lows. Regular insulin peaks in 2 to 4 hours. Watch for hypoglycemia during this window. Seventh, acid-base balance. Normal pH is 7.35 to 7.45. Below is acidosis, above is alkalosis. Check CO2 and HCO3, carbon dioxide and bicarbonate, of the patient to determine respiratory, metabolic, and compensation. Eighth, Maslow's hierarchy of needs. Maslow says basic needs, oxygen, water, food, come before psychological needs. Those were 8 big facts, but here's more key messages you should keep in your head when answering question the NCLEX. Teach smoking cessation. Nicotine patches and other replacement therapies help cut cravings. N95 masks are for TB and droplet precautions. You should fit masks tightly with a seal for safety. Delegate correctly. RNs assess patients and develop care plans. LPNs handle stable care and can perform some medication administration. UAPs take vitals and can ambulate stable patients. Restraints need a doctor's order every 24 hours, with minimum hourly checks for circulation on the restrained limb. Morphine slows breathing by knocking out the patient's respiratory drive. Hold it if respirations drop below 12. Infection control. Gowns for MRSA and C. diff. Masks for respiratory. N95 for droplet. Never cross-contaminate. Gloves and hand washing for everyone. But note, C. diff requires hand washing every time. These facts were covered in the previous video, but they're so important that they're worth repeating. Hand washing stops infections. Scrub for 40 to 60 seconds with soap, no shortcuts. Preeclampsia means blood pressure over 140/90 plus protein in urine. Catch it early to protect mom and baby. Potassium range is 3.5 to 5 milliequivalents per liter. High potassium means peaked T waves on EKG. Normal pulse ox is 95 to 100, act fast if below 92. COPD patients on 2 liters of oxygen at 90% saturation may be at their norm due to hypoxemic drive. Notify the doctor, but don't panic. Drill these with Yes You Can quiz bits, they're in our question packs too. Subscribe to yesyoucan_nurse for more rapid-fire tips and test day hacks. Yes, you can ace the NCLEX.